the Black Death, a name that still sends chills down our spines centuries later. But what exactly is the bubonic plague, and how does this tiny bacterium? Before we dive in, don't forget to subscribe for more fascinating science content. Meet Yersinia pestis, a gram-negative, rod-shaped bacterium that's a master of survival. This highly adaptable pathogen has evolved sophisticated mechanisms to evade our immune system, and it's been perfecting these deadly skills for centuries. The plague follows a classic zoonotic cycle, starting with small rodents like prairie dogs and rats. The disease spreads through the bites of infected fleas. When a flea feeds on an infected animal, it ingests the bacteria, which multiply and eventually block the flea's gut. When this blocked flea tries to feed again, it regurgitates the bacteria directly into the new host's bloodstream. Direct contact with infected animals is another transmission route, but the most dangerous form spreads through the air when the infection reaches the lungs. After 2-6 days, symptoms appear suddenly with very high fever and chills, but the hallmark sign is the bubo, painfully swollen lymph nodes that give the disease its name. These buboes become filled with pus and can turn black as tissue dies. Hit that subscribe button to stay updated on medical mysteries like this. Without treatment, the infection spreads through the bloodstream, causing septicemic plague, or to the lungs, creating the highly contagious and often fatal pneumonic plague. The Black Death of the 14th century remains one of history's most devastating pandemics. It killed an estimated 75 to 200 million people, wiping out 30 to 50% of Europe's population. The massive death toll led to profound social and economic upheaval. Labor shortages led to the end of feudalism and widespread social change. Tragically, minority groups were wrongly blamed and persecuted for the disease. It fundamentally shifted religious and philosophical views of mortality. Yersinia pestis is a master of immune evasion. Instead of being destroyed by macrophages, it survives inside them, using the immune cell as a Trojan horse to safely travel to the lymph nodes. The bacteria possess a molecular syringe that injects toxic proteins directly into other immune cells. These proteins trigger the suicide of immune cells, dismantling our frontline defenses. They also suppress inflammatory signals that would normally rally a full immune response. With local immunity disabled, bacteria multiply rapidly, causing the characteristic swelling. Subscribe now for more fascinating insights into how diseases work. Rapid diagnosis is critical. Samples are collected from buboes, blood, and sputum. Microscopy reveals the characteristic safety pin-shaped bacteria. PCR testing provides rapid, highly accurate DNA detection of the pathogen. Rapid dipstick tests can detect plague antigens in minutes, even in remote areas. With prompt antibiotic treatment, survival rates exceed 90%. First-line antibiotics include streptomycin and gentamicin, with supportive hospital care. What was once a death sentence is now a treatable disease when caught early. Prevention focuses on reducing rodent habitats around homes and workplaces. DEET-containing repellents prevent flea bites in endemic areas. Avoid contact with sick animals and always wear protective gear. Flea control on pets prevents them from bringing infected fleas into homes. The U.S. still reports about 7 cases per year, almost exclusively in western states. Continuous monitoring of wildlife populations helps prevent outbreaks. Modern medicine has transformed the plague from humanity's greatest killer into a manageable public health concern. Subscribe for more medical history content. Knowledge and preparation remain our best defenses against ancient threats.